So when we first talk about the gastric sleeve, it's important to understand anatomically what's happening. We're removing 2/3 of the stomach. People will talk about 2/3, 80%. To be honest with you, most of us do this in a pretty similar fashion, using a pretty similar size bougie so that we can tailor the size of the stomach. And so this makes this a very irreversible surgery. When I do this surgery, it takes about 45 minutes. Most patients have a 1% serious complication rate. You'll typically spend one night in the hospital, although outpatient surgery is certainly very reasonable. And it is about a 1 to 2 week recovery. Really not a major recovery. Most people do very well from the surgery, back on their feet within literally hours, and either home that same day or early the next day with a very modest amount of pain, maybe taking a few pain pills if they take that at all. There's two major issues with the sleeve that I think are really important for anyone considering the surgery. The first is heartburn. I personally do an endoscopy where I put a camera in and look at all of my patients' esophaguses, looking for a hiatal hernia where the stomach's going up into the chest, or significant esophagitis or signs of acid reflux. If you already have significant acid reflux, I would be very careful choosing this procedure. We'll see around 5% of all sleeve patients develop such severe acid reflux after surgery that we have to convert them over to a gastric bypass. 95% of the patients do great, 5% develop severe acid reflux. The second issue is weight regain, and we will see a very substantial number of patients regain weight over the long run after a sleeve. Great 1 or 2 year result. By year 3, 4, 5, we start to see some weight regain, and this can be extremely frustrating. In the past, this was not treatable at all, but now we have weight loss medications, and we found that administering these weight loss medications to treat weight regain after surgery, or just prophylactically to get more weight loss, is a great option, and a sleeve in conjunction with medications is a fantastic weight loss surgery option.